welcome into the home edition of Perspective. Good to have you with us today. We have a special guest and want to get right to it. Dr. Bruce Dart with the Health Department. Dr. Dart, welcome, my friend.
Morning, Sam. Great to be here.
I suppose we ought to jump right into this. I just heard this morning that 10 counties, zip codes are listing at risk at this point, but the new numbers are showing a slight improvement. Are you a little bit optimistic?
You know, I am. I'm really happy that citizens of Tulsa and Tulsa County are following recommendations to keep themselves safe. I think that's starting to be reflected in the data a little bit, and especially as we come into flu season, which we know is always a concern each year. So the combination of COVID-19 and flu will be circulating through our community fairly soon. So it's important to remain vigilant and follow those guidelines, and let's all stay safe.
Really appreciate what you guys are doing with the zip code breakdown. I was looking at it this morning. In fact, you've got it on your website. If folks want to just tack in and see what the latest is, for an example, 74136, which is where I live, according to the chart, is in the yellow.
So there's so much information that was coming out from all these different levels of government, and we know that people were really getting confused about what to believe and really what is risk and what isn't risk. And so we created the risk guide for each zip code so that everyone in Tulsa County would know that no matter where they went in Tulsa County, they would have an idea of what that risk is. And along with that risk map, it also tells them, it gives them recommendations for what to do to stay safe, and it also lets them know how many cumulative cases have been in that zip code and how many people have recovered. So we're hoping we're providing information that allows people to know what's happening where they live, work, and play, and hopefully make the appropriate decisions to once again stay safe.
It seems like one of the best things that can be done at this point, avoid close contact and wear a mask. And I brought some along with me. Of course, this is the one everybody sees for the most part, but they come in all shapes and colors. Black. I've got one here that, because I'm a Razorback fan, that my daughter picked up for me with an Arkansas Razorback on it. A friend made this one for me because I have an interest in music, music notes and all that sort of thing, and one from my church. I guess what I'm reaching for here is to try to encourage as many people as possible to wear the mask.
And thank you, Sam, because that's our message as well. And you know, I love all your different masks. We've seen so many people making some really cool fashion statements with their mask, and I'm a Husker fan. I got my Husker mask as well. So you know, we all know how politicized the simple act of wearing a mask has become, and you know, it's time, I think, to really ignore that and just focus on what we need to do as a society and as a community to stay safe. And the simple act of putting a mask on is one of the safest things that we can do.
Doctor, you just mentioned something I want to get into just a little bit with you, and that's the politicizing the mask angle. It would seem to me that there are folk out there who are either in denial or who see this as some kind of a political statement. It's not. I mean, you're trying to save your life and the lives of those you care about by wearing a mask.
You know, I think it's very clear. I mean, we've had over 200,000 Americans who have passed away from this, over 1,000 Oklahomans, and you know, it's very, very real. And we can call it what we want to call it, but it truly is. To quote someone else, it is what it is. It's a virus that we have no immunity to anywhere in this country. We have some immunity now because of all the infections, but we don't know enough about the virus yet to really know, for example, how long immunity lasts, if antibodies confer full immunity. I mean, there's so much science that yet we have to learn about COVID-19. And so that's why we continue to follow the recommendation, the guidelines, and do the things that you need to do to stay safe. And, you know, politics or political ideology shouldn't prevent you from just doing one simple act.
You know, I don't want to drag you into the political arena, but doggone it, we got a governor that refuses to wear a mask anywhere he goes. You saw what unfolded in Washington. How dangerous is it for the President of the United States right now? What sort of danger is he facing?
You know, we have seen that this disease does progress in certain ways. You don't and the president has the benefit of outstanding health care that most Americans can't get to that level. So we still know that this disease will progress in a way that a few days you might feel better, a few days later people have been relapsing and feeling bad again. So it's important not to move too quickly, not to call yourself cured or recovered before the disease has really finished its clinical presentation within you. So it's dangerous to tell people not to be afraid, because we're not talking about acting in fear here, but we're talking about at least understanding the reality of this virus, and it's here. It can harm people. Some people, of course, as we know, the infection is asymptomatic or there's no symptoms whatsoever, but many people get very, very sick. And we're still understanding really the long-term impact of COVID-19. We have people who were infected early in the response, and some people are still struggling. I mean, they're quote termed recovered because they're not infectious, but they're still having health issues. They're still having cardiovascular and lung issues. So, and those are things we're still learning about as far as the disease itself and what it does to the body. So, it's important not to declare it's over. It's important people remain vigilant. And I'm not saying be afraid, but be aware. I mean, this is very, very real. It has serious consequences for some people, and it's impossible to ignore it.
What's your comfort level insofar as allowing children back into the classroom?
I think there's so many other things here in play. Even more so than transmission of COVID-19, which we know how critical that is. But there are so many social and emotional issues that also come into play here. Behavioral health issues are really going up now, and I think we're going to have a collective PTSD response once COVID is all over. So, school systems are being asked to make really difficult choices, and I'm not sure any choice is the right one, but we do know that the in-classroom platform is a much better learning environment. We know families have been struggling trying to ensure their children are being educated through distance learning model, and teachers are very, very afraid to be back in classroom. So, it's a tough choice. It's a tough conversation. If we can hold classes and still follow the recommendations around distancing and masking and hand washing, for the most part, I believe we can do it very, very safely, because those three recommendations do infer a certain aspect of safety in that room that you're in. So while I don't want to see a packed classroom, I think if we could have a appropriately distanced classroom with all students facing in the same direction, and not letting students congregate in hallways or in a cafeteria and those kind of places where they do congregate, I think school can be held somewhat safely. But let's just know that no matter where we go, it's a risk with this virus, and it's important that we follow those 3 W's of wear your mask, watch your distance, and wear your hands. And it doesn't matter if you're in a grocery store or in a classroom; those guidelines are critical. Schools are doing, I think, a really nice job of creating safety plans to ensure they can meet those 3 recommendations and 3 guidelines. And God bless them. They've worked incredibly hard to keep everyone within their school district safe. And I really applaud their efforts and really their creativity in doing so.
My hat's off to the teachers on the front line. I got to tell you, they're facing an incredible task. What to do about the classroom, and then they have to go home where they have family and children. I mean, it's a heck of a decision to make for them.
It truly is. My heart goes out to all those who are teachers or who are staff in school buildings and school districts, and students and their families. I mean, no matter what we do, it's not going to be 100% for all people, and everyone has their own feelings of what's safe for them and for their families. And there's no one size fits all template for all this. And then on top of that, these school districts have the incredibly difficult task of trying to educate children, and we know that children's education have been disrupted since last March. So it's an extremely difficult call. And my heart goes out to everyone who's in the middle of this, who have children in school and in classrooms now. And this is something that when decisions are made, let's embrace that decision. Let's do this collectively, and let's do this together so that we can get to the other side of this and do it as a community. And because it's been so incredibly hard. And, teachers right now, I think, are one of the toughest jobs that we're totally one of the hardest jobs in this country, one of the most important jobs in this country. And then you add a dimension of pandemic on. The teachers are heroes, every single one of them. And God bless them all.
All, each and every one. It's almost as though they ought to be getting hazardous duty pay. But I would assume, I would hope, and you know what they say about the word assume, but I would hope that our teachers are able to, if they open the classrooms, cover up, mask it, vent it, whatever they have to do to get through the day. It's going to be tough. I'm almost hoping they can do it both ways. They can say, okay, here's the way we're going to play it. Those of you that want to come to school, the classrooms are open. The rest of you continue by computer.
Yeah, I think that's the, there's been quite a few different school-based models, but I think that's the bulk of what most schools have been doing is, giving parents a choice, creating what they call a hybrid model where some kids are in the classroom, some kids are still learning through the distance learning platform. And I think that choice is very important. And as I said before, there's no one size fits all model or template for this. And schools are trying very hard to create models where parents and families feel like they can still stay safe as their kids hopefully learn throughout the environment that is this pandemic.
Well, listen, we're about out of time, and I want to thank you for all you've done, all you're doing, and all you will be doing, because you're setting an example for everybody else in the area. And God bless you, and take care of yourself, my friend. You already know to wear that mask.
Absolutely, Sam. And thank you so much. I really appreciate chatting with you this morning. You guys stay safe at Rogers State, and hopefully we'll talk soon.
Okay, my friend. See you again down the road.
Yes,
Coming
sir.
up next,
Bye-bye.
we've got a most interesting individual. I think he's going to probably roll your socks up and down. His name is Fred Jones. We're going to be talking about some new developments coming out of North Tulsa. Stay with me.